You're about to experience Healthline, a show where doctors from 𝗥𝗲𝗵𝗹 interact with you for a healthy, uplifting lifestyle. Moderated by Nicole Jacinto. You've got questions, we've got answers. So welcome. Hi, everybody, and welcome to Healthline with 𝗥𝗲𝗵𝗹. I'm your host, Nicole Jacinto. Okay, where I am right now, it's so hot, and actually, we're going to talk about something that's related to heat today. And it's also windy. So we're going to talk about something also that's related to blowing today. Anyway, today we're going to talk about smoking cessation or quitting smoking. Now, if you're having a cigarette or a cup of coffee, while you're watching or listening, you're tuned in, I urge you, listen, keep listening. We're not here to preach to you. I'm certainly not here to preach to you. We're just here to inform you, or rather our guest is here to inform you about smoking cessation and the benefits that you can gain from it as a person, the benefits for your health. Now, our guest today is Dr. 𝗠𝗸𝗫𝗵𝗹𝗆. He is a pulmonary medicine specialist from the prestigious Makati Medical Center, and he's here to inform us about smoking cessation. So, let's talk to Dr. Norman right now. And hi, Doctor. Hi, Dr. 𝗏𝗏𝗏.
Thank you for inviting me here today. I'm so glad to have the opportunity to share knowledge about smoking cessation. Thank you.
Thank you, Doctor, for joining us. I'm so glad that we're talking about this topic. We have never talked about this before. And we always hear in our other shows about how smoking is bad for this or quit smoking. But today, it's actually an approach to help, to really help or inform people out there about the actual act of quitting, which is very difficult for many. So, let's just give it a shot. Let's just inform our listeners and our viewers who are out there about what the process is like and all of this. So, okay, Doctor, we always hear that smoking is bad for us, no? So can you just tell us maybe some general reasons why, how does smoking affect a person's health? And maybe we can start with cigarettes first.
Okay. Cigarette smoke is causative of the top causes of mortality and morbidity in the country, no? So mga important na diseases ito affecting, if you would imagine, all parts of the body kung saan nagpo-flow yung smoke, no? From the mouth to the throat to the lungs, even to the gastrointestinal tract, and of course the cardiovascular system, no? So cigarette smoke or smoking cigarette increases the risk for lung cancer, throat cancer, no? Mouth and tongue cancer, no? So sa mga cancer, yun yung delikado na effects ng smoking. For the cardiovascular system, it is the most important risk for heart attacks and strokes, no? So yun yung problem sa cardiovascular system. And sa specialty namin sa pulmonary medicine, it is causative of chronic obstructive pulmonary disease, or yung old term doon is emphysema, no? So it's causative for those important diseases.
Okay, thank you, Doctor. So you've named the basic parts of the body, of our bodies that are affected when you smoke. We're taking cigarettes first, which is of course the mouth, because we inhale. We inhale the mouth, and then the throat because the smoke passes there. You mentioned, of course, it goes to our lungs because we inhale, we exhale, and also our gastrointestinal system, because some of the smoke can get into,
Yes.
It can go down both holes, your windpipe or your what do you call this?
Yeah.
Yes, your trachea. Okay, thank you, Doctor. Now, you did mention that it is causative of lung cancer, throat cancer, mouth cancer, of course, and you also mentioned the cardiovascular system. Can we explain to our viewers how it affects the cardiovascular system?
Cigarette smoking causes premature scarring of the lungs, no? So with continuous injury brought about by the toxins in the cigarette smoke. So if you would think about it, there's damage in the linings of our blood vessels, and with continuous damage, this results to scarring and eventually blockage of the blood supply to vital organs. So if there's blockage in the brain, that results to strokes. If there's blockage in the heart, that results to a heart attack or a myocardial infarction, no? Minsan naapektuhan din yung limbs, no? There could be blockage in the limbs which could cause necrosis or damage in the limbs also.
Okay. So, doctor, basically, smoking can affect every part of the body, not just the lungs, the throat, the mouth, and the heart. And is it because you mentioned scarring in the lungs, and that's how smoking, or we're talking about cigarette smoke first, no, affects the cardiovascular system? Is it because when we inhale oxygen, we need the oxygen, and then that oxygen is taken in by our lungs, and then it's sent to the heart and spread throughout the body in our blood supply. So if there's scarring in the lungs, I just want to know if I'm understanding this correct. You can jump in anytime and correct me or add anything you want. If there's scarring in the lungs, it's the blood vessels in the lungs, or like we might not be able to get as much oxygen as we should. And when it circulates around the body, there might also be like blood vessels in the other parts of our body, like you mentioned, the brain or the heart, that are not getting enough oxygen. Is that what happens?
No, in the lungs, the affected part are more of the airways, no, not actually the vascular supply, but more of the airways. So what happens is with continuous exposure to the toxins in cigarette smoke, the airways become narrow. No? So, and with a narrowed airway, a patient or a person with COPD will have trouble breathing, no? Kasi mahirap mag-flow yung air in and out of the lungs, no? That's why yung tawag din sa disease is chronic obstructive pulmonary disease. There's obstruction in the flow of air.
Chronic, it's always there. Obstructive, nakaharang.
Yes,
can't
the
pass.
airways are narrowed.
Pulmonary, the lungs, and disease, because it's a disease. People used to call this, or they still call it emphysema. That's basically it.
That's the old nomenclature for COPD. Nowadays, we call it COPD.
Okay. And since we mentioned COPD, with COPD, what's the effect on a person? Can you tell us a little bit more about it? Like maybe what the symptoms are, so that people, viewers and listeners understand, somebody might say, okay, so what if I have COPD? I'll keep smoking. Like, what exactly does it do to your body? How do you feel? What's your health? What are the symptoms that can make it maybe more difficult for you?
Yes, the cardinal manifestations of COPD are chronic cough, no? So meaning cough that lasts longer than 3 weeks. There's dyspnea, usually progressive, and again chronic also, no? It lasts for a long time. And there's increased production of mucus or sputum, no? And this occurs in the background of strong smoking history. So usually this is common among elderly male na may heavy smoking history.
Okay. Yes, that too. Since we're talking about cigarettes. Okay, so if you have COPD, some of the symptoms are, well, it will be difficult for you because you'll be like, coughing like that. And then there's usually mucus. There can be mucus, and then, it's chronic, so it's always there. It lasts for a long time. And you did say that there's a demographic for it, that usually it's an elderly male with a long history of smoking. Like how long, doctor? How long?
Usually the risk increases with smoking of, on the average now, 1 pack per day for 10 years. So that's where the risk for pulmonary diseases increases. No? So 1 pack per day, every day, for 10 years.
Okay. I have to play a bit of a devil's advocate here, because we have viewers and listeners or people out there who are smokers, and that's okay. I know many people who smoke maybe 3 cigarettes a day, or just one, that kind of thing. So I understand the viewers and listeners that it can be frustrating sometimes when, doctor, like I understand your position because you're a pulmonary doctor and you see how this affects people. But there are a lot of people who smoke, who learned how to smoke, and who feel that it's necessary, in their lives, or maybe it's an addiction, whatever you call it, but it's part of their, it's part of their everyday living. And that's why later we're going to talk about that when we talk about the actual, like, how to stop smoking. But sometimes, like, a lot of people can get preachy and just say, oh, just stop smoking. Stop it, stop it, stop it. It's bad for you. So later we can circle back and say, why, maybe we can ask, why is it difficult, And I think you're the type of doctor, I mean, this topic is like, thank you for coming on, because you're the type of doctor who would understand the difficulty for someone to be able to quit smoking. Because sometimes when people have this big campaign to just make you stop, you question it and you're like, I don't want to hear it. Parang the opposite happens, no? When someone nags you to stop smoking. So at least for the viewers and listeners out there, they don't we are explaining why smoking, how it affects you, and then what you can do if you want to stop. Okay.
Yes.
So if somebody, you mentioned earlier that an elderly male smoking 1 pack a day for 10 years, that's when it increases. Well, how about if someone says, well, I'm only smoking 1 cigarette a day or 3 cigarettes a day? What would you say to that as a doctor who
Yes.
treats?
Of course, many patients rationalize their behavior.
Yeah, exactly.
Complex problem, no? And this really reflects the underlying problem of, you mentioned already, no, nicotine addiction,
Okay.
which is the underlying problem in the act of smoking. My simplified explanation with regards to that statement is that we're talking about risk, no? And the analogy I use the analogy of it's like a raffle, no? So pag may raffle, no, so you buy tickets, no? And with cigarette smoke, you could imagine that each tick is a ticket for that raffle. But the grand prize is cancer or heart attack or stroke, no? And as you know, the more tickets you send, no?
Yes.
The higher the chance of winning. The more entries you send, no, the more chances of winning. And this reflects the cumulative nature of the damage, no. So if you buy 1 ticket, of course there's less risk compared to 10 tickets, no. But if you don't buy any tickets, then lower yung chance manalo, or even 0 chance na manalo, no? So that's the analogy I use so that the patients can understand the concept of risk. Yeah.
And that's a good analogy, doctor. So you're saying, well, you're increasing the risk. And of course, we know, and the older we get, the more we evaluate our health and the more we feel things, that there are other factors also that come into play. Of course, we won't discuss all of that today, but if you have this and you have that, and then you smoke pa, you're really increasing your risk. Thank you, doctor. That was a great analogy. It's like you're buying tickets for a grand prize that's going to make you sick. That's a great analogy, doctor. I'm sure that a lot of people appreciate that. Instead of just it sounds like that a lot of times. So thank you very much. And I can tell that you were the person to go to if somebody wants to stop smoking. Okay, doctor, we're talking in terms of cigarettes. What are the toxic substances? You mentioned nicotine. Is that really toxic or is just addictive?
So I'd like to spend a few moments on that question, because this is the underlying problem with patients who smoke, no? Actually, we could consider cigarette smoking as a symptom or as a sign of addiction to nicotine. So that's the manifestation of the addiction. Now, nicotine it's actually a naturally occurring chemicals, no? It's found in nature, no? And actually in our brain, there are what's called receptors for nicotine. So basically, the nicotine chemical attaches to these receptors in our brain, no? And what happens is when the patient inhales the nicotine, it goes in the bloodstream and it goes into the brain and it attaches to the nicotine receptors, no? So when this chemical attaches to that receptor in the brain releases chemicals that actually produce relaxation or happiness or satisfaction, we call these hormones, no? And ang common term natin dun are happy hormones, no? So if you ask a smoker how they feel when they smoke, they will tell you those effects, no? They become happy, they become relaxed, nawawala ang problema, no? Yes,
Yeah.
they even hunger, no? Nawawala yung hunger nila, no? So merong good effect, quote unquote, yung smoking in the physiology of the body, no? Now, unfortunately, when they inhale the cigarette, package deal siya with 2,000 plus toxic chemicals, including like cyanide or tar, no, which are carcinogens, no? These chemicals are toxic to the body more than, of course, I cannot give an exhaustive list of the 2,000 plus chemicals.
I see like, there's ammonia.
Yes.
Also, yes, when you see all the
these
ingredients.
toxic chemicals by itself, no? Dito, it's a package deal nga. When you smoke the cigarette, then you inhale all those toxic chemicals also. Those effects are cumulative with each cigarette you smoke, no? But the problem is with increasing consumption of nicotine, the brain develops addiction to nicotine. Now, if we'll talk about addiction now, I'd like to define the conditions so that our listeners can understand, no? Because again, this is the underlying problem with cigarette smoke, no? Now, I mentioned earlier, no, when you smoke, you derive benefit, no? There's pleasure in smoking, no? It's a scientific fact, no? And if you ask all smoker, of course, pleasurable yan. Why would they do it if it does not cause
why would they do it if it makes them throw up or something?
So may pleasure, no? They derive pleasure from that act. The problem is with consumption of addicted substances, and this is true for all addictive substances like narcotics or marijuana, shabu, no? These addictive substances, the patient develops what is called tolerance. No, this is an important aspect of addiction, meaning as time goes by, as the patient increases the consumption of the addicted product, sooner or later, he or she will need a higher dose of that substance to attain the same effect as before. So to get the same amount of pleasure, for example, they just smoke initially 1 stick or 2 sticks, as you mentioned, and they feel good now when they smoke because the effects are the release of the happy hormones. No, yun yung effect niya. Sooner or later, to get the same effect, they need to smoke 4, 5 sticks, no, 10 sticks, and eventually, to get the same effect, 1 pack per day na yung nako-consume nila, no? And in the later stages of addiction, they need to smoke that amount of the addicted substance in cigarette, in the case of cigarette, which is nicotine, they need to smoke that certain amount of nicotine just to feel normal. No, that's where the problem begins. No, meaning if they don't get their dose of the addicted substance like nicotine, there will be what is called withdrawal. No, the withdrawal syndrome. And if you ask our smoker patients, no, what they feel. If they are not able to smoke cigarettes, they will tell you they become agitated, they become depressed, they become lethargic, no? These are manifestations. They can't concentrate, they're not able to work, no? These are manifestations of nicotine withdrawal or drug withdrawal syndrome.
It's the nicotine first. Okay. Yeah, so it's the nicotine. And just to we might circle back a bit to that later with the withdrawal symptoms, but just to you mentioned some symptoms already, so let's go with it. I do know people who, they say it affected their relationships because they were angry, as you said, agitated, and didn't feel like themselves, and then their whatever partners or friends were like, why is this person so angry now? Like you can't be normal. And then a lot of people cannot really think or work well without smoking.
They need to smoke just to become normal or just to feel normal. No? That's the advanced stages of addiction. No?
But I also know, I know someone who smokes 3 cigarettes a day, and it's been like that for like 15 years. What do you say to that? I mean, of course, you would always say, don't even smoke. But what do you say to someone who is in that position, who has the discipline? like there I guess her nicotine consumption, it doesn't seem to be it doesn't seem to
escalate
go up.
na.
Yeah.
Yes. Of course, as I mentioned earlier, no, this problem has many dimensions, no, including behavioral, no, aspect, no. Yun nga, as you mentioned, baka discipline siya in a sense na
Yeah.
able to control, no. There's also a genetic predisposition, both to the development of addiction and to the development of complications of cigarette smoke, no. So meron ding effect yung constituency nung body nung person, no, and this has something to do with the genetic component nung body nung patient natin, no? So merong mga patient na predisposed to develop the complications early, no, kahit bata pa lang nagkaka-cancer na. Yung iba naman may anecdotes tayong naririnig, di ba, 20 years na nagsisigarilyo pero parang fit pa rin yung patient, no, parang immune sila dun sa effect ng cigarette smoke.
May nakita, may yung nanay ng isang priest na kilala ko, she turned 92, nag-yosi pa rin. Di ba?
So it's an interplay of many factors, no? Ang sinasabi namin sa mga patients na gano'n, na again, rationalizing the no? Nabuhay na daw siya ng 90, nagsisigarilyo. But you could always argue, pwede sana siyang 100 or 110 kung di lang sana siya nagsigarilyo. So marami namang counter argument. Of course, we avoid arguing with patients kasi hindi naman yun yung solution talaga to the problem. As you mentioned, this could actually be a turn off, no, for our patient, and they become unmotivated to quit, no?
Because they feel judged.
Yes.
Very often, especially with I know we're talking about some social issues here, but it's related to we're talking about, especially for the strong campaigns that we have had globally against smoking, and yet there's a kind of hypocrisy because it's still sold, and you can get sick by drinking too much coffee or whatever, and people don't explain it the way that you do. That's why I'm so happy that you're on the show today. And doctor, okay, so when we talk about nicotine, as you said, because with cigarettes, it's a package deal. The addictive substance is nicotine, and it's natural. And okay, there's really, cigarette smoking is about addiction. Nicotine, there's addiction. And we can get addicted to natural substances. I mean, our bodies. And you said our brain has receptors that bind with the nicotine. So do you think that smoking, I mean, people have been smoking for hundreds of years, and then, tobacco was a big industry, still is actually. And then in first world countries, they decided to send the junk to third world countries like us. Like, they have better cigarettes there, and it's more natural. There's more nicotine than tar and ammonia and all that stuff. And I know this because I had a friend who worked I won't say in the company. My God, they might sue me. But who worked in that, and just send the stuff to Asia. And in Asia, kids start smoking at 10. So go ahead, just send like whatever we make. Let's have the cheap stuff there and the good stuff here. So there's like the good cigarette and the bad cigarette. So nicotine, do you think people, is it, historically people have been smoking. So of course, okay, here's an argument. You might call it rationalizing, but so maybe our body does need nicotine, or it's not so bad. No, because if our brain has receptors for it, then did humans develop this way? Did we always kind of have a proclivity to need or attach to nicotine, just like maybe sugar or some other substance?
As I mentioned earlier, no, it's a naturally occurring chemical. The problem is when the tobacco industry exploited and turned it into produce the product on an industrial scale, no. And they did this knowing the ill effects, no. It has been found out that they know of the ill effects of smoking early on in the development of the industry, and they have actually been fined for this. They've been fined billions of dollars, but still, syempre, mas malaki pa rin yung kita, no? So alam na nila yon. So much so that if you look at the product ng mga tobacco industry, nakalagay dun no?
Yeah.
It's the only product that is harmful when used as intended. Ganun yung joke dyan sa medical community, no? Usually, it cause harm if hindi tama yung pag-use. Pero ang tobacco, pag tama yung gamit mo, nagkakos ka ng harm to your body, no? Acknowledge ito ng tobacco industry, no? Alam nila na sunset industry na ang cigarette smoke. That's why they're pivoting to electronic cigarettes, no, which is separate topic altogether. Siguro later dun tayo
We'll go here in a few minutes.
Yes. So alam nila na walang patutunguhan yung ano, kasi lahat ng bad effects nito, ano na, aware, it has been made public at aware naman yung society. Kaya lang, yun nga, the victims of the tobacco industry, yung mga na-addict na sa nicotine, hindi na nila makontrol yung habit kasi nga it's beyond meron ng physiologic hold yung nicotine sa kanila, and this is the problem that we're addressing, no, one patient at a time, no. Pero the bigger problem is the industry, no, na nagpo-produce nung harmful product na ito.
Kasi doctor, parang in the olden days they used to roll their own cigarettes, tobacco talaga. Diba? So okay, that's less harmful. Harmful pa rin pero less harmful kasi it didn't have the other substances. But when, as you said, when the tobacco industry industrialized it, it's easier just buy a pack. Or buy a rim, whatever. Kung ano-ano nang nilagay para magtipid siguro or whatever yung intention nila. Diba?
They made it accessible, no, more convenient, more efficient yung delivery ng addictive na medication. Tapos less yung irritation, no? Actually, irritating yun pag in-inhale ang tobacco leaves na raw or yung niro-roll pa. Masakit yun sa throat So they developed an efficient product. Yes.
Okay, I see. Yeah. I just sharing when I was a kid one time, we wanted to smoke. I got a guava leaf and I tried to smoke it. Anyway, that's
irritating siya Pero parang ganda ng product nila.
Okay.
Isipin mo kayang inhale ng patients yung smoke na yun, no? Which is originally, yun nga, hanggang mouth lang yun dapat
Yes, okay. And now let's go to something else that may be more natural than cigarettes. Another form of smoking. Can I ask you about cigars and pipes? Because that's tobacco leaf, diba? Even the cigar, it's rolled with a tobacco leaf. And, when you smoke cigars and pipes, it's hit buga, what we call hit buga, like it only stays in your mouth. Can we talk about that? Like, what are your thoughts on that? Because you don't inhale it. I mean, are there differences in the adverse effects? And are substances purer because parang, nicotine yan. More nicotine or pure nicotine yan?
Parang siya yung natural.
The natural.
It has something to do dun sa yung concept na I mentioned earlier na where the toxins get to, no? So kung cigarette smoke, nakakaabot sa lungs, no, sa ibang organs. Sa cigars or pipes, sa bibig lang siya So the aforementioned adverse effects are more on oral problems, no? So, halimbawa, cancer. So, cancer of the tongue, cancer of the mouth, no? But still, yun pa rin. Cancer pa rin, no? So, totoo na less ang lung cancer, pero may cancer pa rin kung saan nakarating yung tobacco smoke, no? So, it's a matter of exposure talaga, no? At saka yung yung severity or the degree of the smoke, dose. Yes, once a day lang, no? Or pag cigarette kasi, di ba, parang yun nga, 20 sticks per day, mas mataas yung dose niya. Yes.
Cigarettes kasi are so convenient They're fat.
Yes.
And then they give you a hit because you inhale. And you can throw them. Cigars are something you enjoy, no? Something you can really relax and enjoy with. But what if someone said to you, well, because cigars aren't always smoked, na they're not really yung tuloy-tuloy. You don't finish one right away. You set it down, or like tobacco, you get a little, you put it in the pipe, you light it up, then you're like Sherlock Holmes, puffing every so often. would you still consider that bad? Any use of cigars or pipes? I know you have to say yes, but still, let's say someone is disciplined about it.
So
Like,
we'll always go back to the concept of risk, no? So
Yes, risk.
you want one ticket, that's fine.
Yeah.
Or you want 10 tickets, no? I'd
Mm.
like to highlight one aspect of that scenario, no?
Yes, yes.
The tobacco industry actually invested a lot of money in glamorizing the use of tobacco, no, including yun nga cigarettes, pipes. So much so na yun nga before, no, it was considered glamorous, no, or yun nga, intellectual, depending on the
Yes.
image that you want to project, no. Of course, they don't project the image of someone with stroke, no, after smoking cigars or cigarettes. Hindi na highlight yun, and hindi yun napapakita sa advertisement or sa cinema, no.
Yes.
So that this highlights the effect of the multi-billion effort of the tobacco industry to glamorize smoking. And actually right now we are in the phase where we are what's called denormalizing cigarette smoking, no? So hindi na siya parang acceptable behavior, and we're trying to reverse yung mga epekto before na smoking is considered yun nga glamorous, or if you want to project rebel lifestyle, na may mga ganyan, depende
Yes, I understand.
no?
The cigarette or the cigar with a leather jacket, motorcycle.
Yes,
that's
yan.
yeah. So
Advertisement yan eh. So may conditioning na ginawa before na cigarette smoking will make you this, kung ano mang image yung gusto mong gawin, no?
But
Pero
don't
hindi
you think
nakita yung may sakit, no?
don't you think it also reflects reality? Pero hindi na reflect yung reality of yung
After.
sakit. Yeah.
Yun yung
So that's the
problema.
unfair part. Yeah, that's the unfair part. I agree with you. I mean, but there are though a lot of I still see a lot of movies or whatever you call it where they are smoking just smoking. Maybe because it reflected the time also. People were not aware. You
Yes.
know, and that, that's how it was. They smoked, they drank, and people, before people would smoke and women would smoke when they were pregnant because it wasn't people weren't aware. It wasn't
Yes,
a thing.
that's true. Because the industry hid the knowledge or the information
Yes.
of that's why they were sued and they were fined, they were guilty of that issue, no? And now that we know all this information, we're denormalizing cigarette smoking, no?
Doctor, when we talk about smoking cigarettes, pipes, and tobaccos, they're all tobacco leaf. Is there something to do also with actually lighting it, like starting a fire and something burning, and then putting it in your mouth? Does that make it more dangerous? Because we're gonna slide into other types of smoking where it's not lit, there's no actual fire or burning that's happening.
We could start to talk about the behavioral aspect of the disease, no? Kasi parang if we study the what smokers go through, no, with their journey into smoking, ano siya, may ceremony, no? It's a learned behavior, no, na nagiging routine, so much so na hindi na nila iniisip no. So for example, pagkakain, kuha ng sigarilyo, maglalight, or pupunta sa balcony, magmumuni-muni doon. No? So merong ganong na siya, parang habit, kaya habit eh. So it's a learned behavior na part of the management is behavioral treatment na tatanggalin na siya sa routine, no? This also reflects mga fixations no? Specifically oral fixation, no?
Yes, okay.
Some patient, yung ibang pasyente sabi nila sa early part of their smoking cessation attempt, lalagay lang nila sa bibig kahit di mo na daw nila.
Yes.
May mga ganung bargaining.
Oral fixation, because a lot of people get oral, they're still children, they have oral fixations.
Yes.
So like fixations, hindi naman fixations. But can you talk about that? Because that I think contributes a lot to the, as you put it, behavioral aspect of smoking or needing to smoke or wanting to smoke. You always have to have something in your mouth.
Yes. Ano siya hindi ako masyadong expert sa psychiatry, no? But in terms of the smoking problem, no? So may behavioral aspect siya na patients are I could use the term compelled to do something, no? Parang wala na silang control in their behavior, no, na automatic na, no? And this occurs in the advanced stages of nicotine addiction na nagulat na lang sila, hawak na nasa bibig na nila yung sigarilyo, nalingat lang ng konti.
They have toothpicks in their mouth.
Yes.
I mean, that could be also because of an oral fixation. They don't smoke, but they have like a toothpick or something like that.
Essentially, hindi normal yung feeling kung wala yung behavior na yon, no? And that's a manifestation of advanced addiction, no? You need to do that thing just to feel normal. Initially, you do that thing to derive pleasure.
Yes.
But eventually, para lang maging normal, kailangan nang gawin yun,
So
no?
at first, you have the control, but later on, it controls.
Wala na. This will also help people who manage the healthcare workers who manage this problem to be less judgmental, na sabi nyo nga na yun yung problem talaga. And that's why when we train healthcare workers who will manage this kind of patients, so yun yung number one na isa sa mga major lesson, na hindi sila yung victims, no? It's not hindi nila kasalanan na nagsisigarilyo sila. Let's not judge them, no? And address yung underlying problem. Victims sila, no? So ganun ang mindset.
The judgment. And so you train healthcare workers pala. Okay, let's circle back to that later. Yeah, a lot of people feel judged, or even when they ask you, did you ever smoke? You know, parang may judgment na kaagad, like you're down your history, and then they're like, are you sure? And you know, parang everybody kind of gets judged now when it comes to that. Pero yung pala yung nagtatanong nagyoyosi rin. Okay.
It's another problem altogether.
Another problem.
Role modeling yung tawag dun eh. Kailangan need to be role models. No?
Doc, you mentioned e-cigarettes. So let's talk about e-cigarettes and vapes, no? So, okay. What about them, no? Are there different, what are the unhealthy effects? Is it different from cigarettes, cigars, and pipes? Can you tell us about that?
So, medyo maraming issues na kailangan i-bring up with this topic, no? And again, thank you for the opportunity so that we can air our views and stand on this problem, no? So, my personal take, no, this is now parang version 3 nung product. No? I mentioned earlier, the tobacco industry is continually refining the product, no, making it more potent, making it more efficient, making it more acceptable. But in our stand is that they are not making it safer, no? Hindi siya ganong level. And the tobacco industry actually acknowledges this, no? Kasi harm reduction yung nila lobby. Hindi nila masabi na this is a safe alternative to cigarette smoking. Ang sinasabi na this is less harmful, no? So maingat sila sa terminologies nila kasi may mga legal implications yun no, pag claim nilang safer, no? So e-cigarette, ang concept nito is that they develop a product wherein the patient can get a more pure form of the smoke, no, na so much so na ang goal ay nicotine lang yung makarating sa brain ng patient natin without the 2,000 plus chemicals, no. The problem is hindi siya ganun no. There are still additives in the product, no. There are still propellants, no. And ang data namin, no, and this is documented ito nasa mga clinical journals at this has been reported to regulatory authorities, no. The new product is causing a new disease, no. Dati COPD, cancer. Ngayon, merong epidemic actually of what is called electronic cigarette lung injury caused by electronic cigarette or vape, no. It's called 𝗔𝗲𝗍, no. Acute lung injury yung term for the disease, no. And being new disease, so parang siya, we are just getting data, no. We're collating data, we're starting a registry para ma-document yung yung trend na ito. So much so that this could be used we could report this to the regulatory authorities sa government, no, para maka-act on the data, no. So what happens is that in the case series, no, that we are seeing, essentially sa US ito nagsimula, nagkaroon ng
Yeah.
epidemic doon. Locally, meron ng case series din na nakikita around, I don't know the exact figure, pero mga around 10 to 15 patients na Filipino patients na nagkaroon din ng acute lung injury from vape, no. What happens is that there's severe inflammation in the lungs of the patient, no. Parang inflammation ang parang loose translation doon. Parang namaga yung lungs ng sobrang severe at sobrang bilis. So much so that these patients actually had respiratory failure, meaning na kinailangan lagay sila sa ICU and hooked to a mechanical ventilator. Ganun ka-severe yung lung damage, no? Initial investigation pointed to the additives of the vape products. Still not the nicotine, no? Kasi sabi nga sa inyo, ano naman siya, it's a naturally occurring product, no. Ang ill effect niya is addiction. Not much on the physical effect, pero addictive sobra yung nicotine. Pero yung propellant of the vape, yun yung naging problem. It's I don't recall the exact chemical, but it's some sort of oil that was added to the product. Important yun kasi gusto nila nagpo-form ng magandang plume or smoke. No, yun yung
exactly.
yun yung paganda ng smoke yun
When you see propellant, doctor, it's the mechanism that pushes the
Yes, kasi hindi na siya combustion yung po-produce ng nicotine. So may parang propellant na siya. No?
When every time you mention propellant, I remember CFCs like carbohydrate. Parang dun
Yes, parang similar concept, no?
Similar concept like when you press something and it sprays, there's a propellant. So but they use this type of oil or whatever substance to push it up and then cause like a nice smoke. So
yes,
because it's part of the psychology.
Yes, ang initial nila kasi parang advertisement, parang water lang, water-based yung pero hindi ganun yung actual product no. So that's the problem na nakikita namin, no? So that's the first, yung direct disease na caused by vaping, no. The second problem is again with regards to the problem of addiction, no. So dalawa yung aspect nito. It is being marketed as a smoking cessation tool, no, meaning among smokers, halip na mag-smoke sila, mag-vape na lang kasi less harmful nga, no. But if you think about it, vaping will not address the underlying problem, which is the nicotine addiction. Yun yung ini-skirt na topic ng tobacco industry na hindi ba nicotine addiction yung problem? Why do you want them to continue to be addicted? Of course, ang sagot dun, profit naman, di ba? So that the patients will continue to buy yung nicotine products kasi nga tuloy-tuloy yung addiction nila. So that's not the solution. Ang solution is to treat the drug addiction as we would like to treat any other form of addiction because it affects function. Yun naman ang goal, no? Mabalik yung function ng mga pasyente. No? Now, the next... Yes.
No, go ahead.
The next problem is that this is becoming the gateway product or the gateway drug among those who are not smoking, no? Specifically the young patients, mga adolescents, no, even mga elementary school kids, nag-start sila mag-experiment with vape muna, no? And kita sa design ng products na attractive siya to the younger generation, no? Yung packaging niya, no, minsan mukha siyang sleek na device, no, mukhang USB or some form of high-tech device, no, na geared towards the younger generation talaga. And sa halip na pampatigil siya magsigarilyo, baka ito yung gateway nila towards developing the addiction to cigarette smoke, no? Kasi the patient will develop tolerance nga, no? They want higher and higher levels or doses of nicotine that they can't get from the vape products, no? So that's the second problem, no? Now, the third problem is with regards to regulation, no? The vape law that was recently approved by our government, no, transferred the regulation of the vape industry to the Department of Trade and Industry. So ginawa nila sa DTI, which is against our stand, no. This is this is a drug, no? This should be under the regulation of the FDA, which is more stringent, no? Talagang concern sa safety ng any pharmaceutical products or anything that we consume, kasi food and drug yun, no? So bakit siya nasa DTI, no? Of course, maraming ano dito. I could speculate pero wag na lang, no? Pero yun nga.
Okay, let me speculate for you. There are a lot of people who probably lobbied for it,
Yes,
and
exactly, no? So
funds were released, and maybe some people accepted them, or they had attractive packages, and there was a big movement. You know, when a lot of people lobby for things, lobbying naman is just advocating for one thing over the other. There's a lot of lobbying that goes on with government or even in the private industries, and lobbying could be for good things. It could be for, you can lobby for a law, you can lobby for a cause, you can lobby for an industry. So that I'll be the one to like say that for you, doctor.
thank you. Thank you for
Yeah.
the,
So,
for
there were, and then there was a necessity to pass a law, but it wasn't really thought about, and then somehow it got pushed. Is the law
yes.
already like passed? Like it's not on any both the lower house and the upper house, like the Congress and the Senate, and signed
Yes.
already by President.
It is already, it has lapsed into the law, into law, no? So essentially, yung last ditch stand ng medical community noon is that we were lobbying for the president to veto the bill, but the president did not veto the bill, so it lapsed into law. So ganun yung nangyari po dun.
Yeah. Okay. So yeah, it should be with the FDA. And then
It should. Parang common sense siya.
Yes. Not the Department of Trade and Industry. Of course, the Department of Trade and Industry, not saying that they're bad, but they would have to deal with the trading, and that's what they're there for. And the Department of Food, the Food and Drug Administration, they're there to evaluate our products, see if it's safe, blah, blah, blah. And there's also lobbying that goes on in all of these
Baka hindi kasi sila yung competent agency to address yung safety issues na binibring up namin.
Yeah.
So it's about competence din eh.
Yes, I agree. They're not trained for it. They're there to trade, to deal with the trade and industry and businesses, and help people, help the country, help entrepreneurs. Like they're there for us to earn more, to gain more, to have a better economy.
Exactly.
So if you can't blame them with the FDA, they're there to basically like check all the ingredients, police things really a lot, so to see if we are consuming things that are not good for us, that shouldn't be on.
Exactly. So actually the fight continues, no? So that's why we're continually gathering data. The lobbying efforts are still there. Baka kailangan i-revise yung law, or I don't know, but there are efforts that are still being undertaken to continue our drive for tobacco control pa rin.
Yes, I mean, another bill could be filed to change the agency that handles it, and filed, passed, lawyers passed in the Senate, and there. Yeah, so the lobbying continues. Okay, so wow, that's quite a lot. See, I mean, for smokers, we learn a lot about it, and it's not just a matter of there's so many factors that play into it. And thank you for telling us and assuring smokers that we are not judging you. We are trying to help you. But I do have to ask you a question that popped in earlier. You mentioned marijuana. How do you feel about marijuana smoking? It's considered medicinal at times, or there's medical marijuana, and in other countries, it's legal and prescribed by doctors. So what do you think of?
So we will go by the evidence, no? So currently nga may move towards legalizing the drug, no? But of course currently it's a prohibited medication, no? So it's a criminal act to use this substance for now, but it's a scientific discussion, so evidence will be presented. There are benefits, there are risks, and we will rely on the wisdom of our leaders to judge whether the benefit outweighs the risk, no? But yun nga, merong certain jurisdictions na ang judgment nila is the benefit outweighs the risk, so na-legalize siya, no? So currently merong naglalabi for, merong naglalabi against, but ang current state kasi is that evidence is being evaluated pa, kaya ayokong
Okay.
para gumawa ng judgment at this point. But currently, it is prohibited by law. No? So hindi siya option talaga at this point. In the coming years, months or years, baka magkaroon ng clarity yung yung situation. Kasi gano'n naman yung science, no? Kung may bagong information, old information, useless siya, delikado siya, pero scientific advancements are being made daily, baka naman ngayon meron na siyang benefit, then objective yung assessment for that problem, for that issue. No?
Sorry for treating you like a hostile witness. No, I'm just kidding. I enjoyed very much. I can tell you're versed. I mean, of course, doctors are intelligent people. You have to understand all these things, and you're also versed in the whole picture, including the laws, the lobbying, everything. So I'm very grateful that you're on the show. I'm very happy you joined us, and
thank you.
The right person to talk to about this. And as I said, we have never talked about this topic before, and it's great. I hope you come back and we talk about it again. But okay, so now, doctor, let's go to secondhand smoke. Let's define that for people, because we're talking about people who are smoking. What about secondhand smoke?
So secondhand is being exposed for in the long term to someone who smokes. So essentially, ang operational definition nito is if you live with someone who is an active smoker, no? So pwedeng spouse, pwedeng child nung smoker that who lives in the same household, no? So yun yung parang operational definition. I'm saying operational definition kasi mahirap i-quantify.
Yes.
Sure, masyadong maraming factors Yung ventilation, gaano kalaki yung house, ilang oras sila magkasama, no? Hindi masyadong measurable yung dose as opposed to the actual smoker, no?
Or to ask you lang, Dr. Sartin, but because like if somebody says you're in a bar together or you're outside with your friends and one of them is smoking of that secondhand smoke, but you don't consider that, parang you're
hindi pa siya
operational. You're saying the operational thing here is if you live with someone who smokes.
That's where the risk of respiratory diseases increases, no? Again, we're talking about risk, no? And the defined risks are the following, no? Number one, development of COPD pa rin, no? Kahit kasi maliit yung dose, which the cigarette smoke which gets into the body, the problem is the duration of the exposure, no? So kahit paunti-unti, pero 20 years, 30 years mong kasama, yung cumulative damage is the same as actual smoking. That's number one. Number two is the risk for exacerbations of pre-existing lung disease. For example, asthma. No? So pwedeng maka-exacerbate siya kasi trigger ang cigarette smoke. No? For cancer, hindi pa masyadong quantified. No? Pero compared to someone who lives with a non-smoker, increase pa rin yun. Pero yung increase in the risk, hindi pa namin quantified siya. No? And actually, we try to use yung concept na to motivate smokers to quit, no? Kasi kung hindi man for their own good, no? Kawawa naman yung yung loved ones nila, no? Yung wife, yung child nila na walang kamalay-malay, inosente, sila pa yung nagkasakit because of secondhand smoke.
Do you treat it do you individualize your treatment? Because let's say people live in a house. I mean, people, of course, they live together, live in a house. The smoker goes out of the house to smoke. Do you consider that? I mean,
that will, of course, lessen, again, risk na naman. No? So, bawas na naman yung ticket ito kung sa labas siya nagsisigarilyo. Kasi bumababa yung dose nung cigarette smoke na na-expose yung household
wag lang lalabas.
Talaga pag indoor smoke, actually indoor smoking is banned by law no? So merong law na which regulates tobacco. So bawal naman talaga ang indoor smoking. Pero syempre it's not enforceable sa mga houses na hindi yun magagawa. So volunteer na lang sila nasa labas magsisigarilyo. Now meron akong introduced na bagong concept which is yung third hand smoke, no? And this pertains to smoke na dumidikit sa damit, no, sa carpet, no, sa furniture na again mahirap i-quantify pa, bagong concept pa lang ito, inaaral pa na again it has something to do with the duration of the exposure. So maliit yung dose pero tuloy-tuloy yung exposure. Tapos kahit sinabi ng smoker na sa labas naman siya nagsigarilyo, pagpasok niya hindi naman siya nagpalit ng damit or nilaban ka agad yung damit niya, may exposure pa rin doon to third-hand smoke. So,
Ako nagpapalit ng damit.
dumikit kasi doon yung, ideally, kung nag-smoke siya tapos ayaw niya talagang ma-expose yung household, diligo siya muna bago siya lumapit doon sa anak niya, no? So, ganun yung strict na enforcement sana in the household. Pero,
Kung may 6 foot distance, nagsigarilyo siya, nagpalit siya ng damit, tapos may distance naman.
minimal yung exposure. Fair naman yung na yun, yung assessment, yung judgment na yun. But, yun nga, ang madali talaga, wag na lang siyang magsigarilyo. Kasi going through all the efforts.
Ano lang, di ba? We have to do that kasi
Yes, we need to protect the innocent yung mga children, no, yung mga loved ones niya. So, kung may sarili siyang issues, i-resolve 'yan.
And okay, so doctor, how do you limit if you live with someone who smokes, how do you limit your exposure to them? And also, in turn, how does the smoker limit the exposure of the people they live with?
No, ventilation pa rin yung answer talaga, no? Indoor smoking, no talaga yon. So, kung mag-i-smoke siya, merong designated smoking area na well-ventilated or ideally outdoors. Outdoors talaga yon, no? Pero yun nga, kung multi-generational household, may mga disability yung kasama niya or immunocompromised na mahirap eh. So actually we use it as a motivation para nga mapakwit yung mga pasyente, and actually it's a powerful motivation eh. Maraming heavy smoker ang nagpatigil sa kanila nung dumating na yung firstborn child nila, no, or nagkaapo kahit second generation, no. Talagang biglang motivated silang mag-quit eh. Para hindi nila mabugahan ng smoke at mag-develop ng disease. And 2, yung role modeling na ayaw nila na when the child grows up, siya yung role model, magsigarilyo din. Na, alam naman kasi nilang mali yung pagsigarilyo pero heavily addicted. Ayaw nilang tularan sila nung children.
Yes.
So it could be used as a motivation.
I mean, okay. We talked about, especially kung in the Philippines, we have multi-generational households. That's the norm, rather than the exception. Okay, so we've talked about that and the limiting of exposure. And so, Doc, okay, what benefits can someone get from stopping smoking, whether it's cigarettes, vape, cigar, pipe, marijuana, whatever? Okay.
May meron kami sana pala dinala ko yung graphic, no. May per minute by minute benefit no, na after so and so minutes yung obstruction dun sa blood vessel nag-i-start ng mabawasan, no. Bababa na yung risk ng cancer, unti-unti bababa yung risk ng COPD, bababa yung risk ng stroke, no. Overall, it's the single most effective public health measure. Yun ang parang grand statement na sa lahat ng pwede nating gawin for our health, and this includes syempre lahat importante, pero
yes,
sabi natin exercise, proper diet, na matulog ng maaga, uminom ng medication, sa lahat ng aspects ng healthy lifestyle, ang pinaka-effective at cost-effective is smoking cessation, without doubt, no? And this is true from the patient level to the public health level or even societal level, no? Siya yung pinaka-cost-effective talagang public health measure. Isang measure lang, bagsak ang cancer, bagsak ang stroke, bagsak ang heart attacks, no? Improve ang lung health, improve ang lifespan ng mga pasyente. So, yun yung magnitude ng effect. And hindi pa natin pinag-usapan yung economic benefits din, na hindi na sila nag-a-absent, hindi na gumagastos sa sigarilyo, hindi na nagagastos yung PhilHealth funds para i-treat yung mga may cancer at na-stroke, no? So, ganun yung magnitude ng benefit ng cigarette smoking.
Okay, doctor, we just, and the viewers and listeners, we just have to take a short break, but we'll be back and we'll talk more about smoking cessation or quitting smoking, and we'll ask doctor, how is it done? We'll talk more about the meat of the actual topic here of how do they do it? How can you do it, or how can your loved one do it? And it's just information, okay? No judgment here. So stay tuned. If you're smoking a cigarette, just keep listening. Okay, stay tuned please to Healthline with Makati Med. We'll be right back.
You're listening to DZRJ 810 AM. We'll be right back after these reminders.
Hi, this is Dr. 𝗛𝗲𝗁 from Makati Medical Center, and I'm happy to share that our world-class quality healthcare with the heart is now more accessible and affordable via Makati Med Mobile Care Access. As the name suggests, this service is mobile, which means that we go to where you are. Mobile Care Access deploys a team of professionals for face-to-face consultations and to conduct basic laboratory and diagnostic procedures, as well as vaccination and testing, depending on your needs. We can go to any location of your choice within the metro and readily offer these healthcare services to communities or groups. For added convenience, different modes of payment are available, including HMO benefits for those with a valid letter of authorization. We believe that access to affordable, quality, and compassionate healthcare is a basic human right, and we at Makati Med are doing our best to make this possible to more people. For inquiries, scheduling, or pre-registration, you may reach out to us at the following numbers. We look forward to coming to you and serving your community with Makati Med Mobile Care Access.
You're back with Healthline, keeping you healthy, moderated by Nicole Jacinto.
Hi, everybody, and welcome back to Healthline with Makati Med. Today, we're talking about smoking cessation, and a lot of the viewers out there are just like quiet. We know they're viewing, but maybe, because they don't want to stop. But as I said, just keep listening. It's just information. And if you are interested in quitting smoking, or maybe one day you will be, or someone who's interested, this is the show for them. You can watch the show, of course, over and over again on the DZRJ Radio 810 AM. That's 810 AM Radio Bandido YouTube channel. If you haven't subscribed yet, just go ahead and do it. Just click. It's free. You can also watch us on Facebook, and you can watch over and over again to learn all the details and really like absorb the information that Dr. 𝗛𝗶𝗶 is giving us today. He's a great guest, and he has no judgment about smoking. He's just trying to help people quit smoking. I understand that, Doc. Thank you again for being on the show. No, we're having such a great conversation here. Actually, Doctor, we have some greetings. Michael A. Manalo says, happy watching from Las Piñas. Thank you, Michael. Bianca says, hi, Nicole, watching you from Louisiana. Oh, Louisiana, USA. Thank you very much. I've been there once, and that was before Hurricane Katrina. So I really enjoyed that trip. And yeah, there was smoking. Okay, Doctor. We're talking about quitting smoking, and we're getting into that really right now. Like, what do you do? How long does it usually take to quit smoking? And maybe you can tell us from a medical or scientific point of view, like, why is it so really hard to stop smoking? You already said earlier why, but maybe just a little bit of recap to remind our listeners and viewers out there of why is it so hard, and how long does it really take to quit?
So the usual comparison of the extent of the addiction to nicotine is the addiction is even stronger than narcotics, no? So ganun katindi yung addiction, no? So it's a big problem from a biochemical point of view. Tapos yun nga, meron siyang behavioral component na naging part of life na nung patient yung smoking. Tapos there's also the problem of yung insight of the patient, no? Kasi kahit in this day and age, marami pa ring patient na hindi alam na the harmful effects of smoking. Yeah, for example, they've been coughing, no? May term na smoker's cough, parang part lang ng life nila yon. Yung pala COPD na pala siya, no? So may mga ganyang stories na maririnig tayo na they don't consult. And ito yung one important message that I'd like to highlight sa talk na ito, na smoking is a medical disease. No? So yun yung bagong paradigm. No? So diagnosis na siya. So when you see a doctor na discover na smoker kayo, kasama na yun sa medical disease na listahan ng patient kapag in-evaluate yung pasyente. So it's a medical condition. No? So much so that
Is it like saying alcoholic or a drug addict, something like that?
Yes, kasama din yan. Na drug addiction, medical condition yon. Alcoholism, it's a medical condition. No? So, dahil diagnosis na siya na ngayon, meron ng recommended treatment for that. So, it's not just a habit, no? Or parang, yun nga, ano lang siya, parang cultural thing, no? It's a medical condition. So, that's an important...
People smoke socially, just like they drink socially, you know?
Ano pa rin, may ano naman as with any disease, merong severity, di ba? So, sila parang mild lang yung disease nila, merong severe na heavily addicted, no?
So, you mean like if you drink 1 glass of alcohol, let's say 1 glass of wine a month or every 6 months when you meet friends, you're not an alcoholic. So, what
Hindi
if
pa na. So there are what's called the diagnostic criteria. No? So meron din naman nag-try lang. Label ka na.
I'm that because it might sound like a judgment. What?
Yes. So to clarify my statement, if the patient fulfills the diagnostic criteria for nicotine addiction or cigarette smoking, ano na siya? It's a medical diagnosis. Now this is an important concept kasi this will prompt the medical system to address yung problem na yon, no? Hindi na siya i-dismiss lang as a risk or a habit, no? So it has to be addressed. So again, ang analogy natin, di ba, pag hypertension yung diagnosis, kailangan siyang gamutin, no? May management. Ganun din ang cigarette smoking, no? Now, how is it diagnosed? Relatively straightforward naman, no? We ask the patient, does he consume? Again, in a non-judgmental way, does he consume tobacco smoke, no? Ano yung amount? Ano yung situations na nagsisigarilyo siya? Nag-try na ba siyang mag-quit before? So we gather all important information pertinent to the diagnosis, no? With regards to the severity of the addiction, again, may diagnostic criteria na uli yun, no? So nasa guidelines na siya ng clinical practice. But to give you an idea dun sa mga criteria na yun, one thing we ask is, anong oras yung una mong stick ng sigarilyo? No?
Yes.
Just one question, sobrang powerful. Pag sinagot niya, upon waking up, heavily addicted siguro ito. Parang ganon yung utility nung test na yun, no? So marami pang ibang criteria, pero just to give an idea, no, na paano ba tinetest yun. So yung time ng first stick, that gives a strong indication that the patient is heavily addicted to nicotine, and we tailor the management according to the level of addiction. No? No, so diagnosis pretty straightforward, no? History, we interview the patient, no? Wala namang lab test na recommended for the diagnosis of cigarette smoking. Merong mga tests, but it's more for research purposes. At the clinic setting, hindi naman kailangan ng lab test, so history lang. Now, it's a different matter with the diagnosing the complications of smoking. For example, if you want to screen for COPD, merong pulmonary function test na kailangan gawin. If we're considering cardiovascular disease, baka kailangan ma-stress test sila. No? So, ano na yan? Case-to-case basis na. No? And this is important kasi we need to screen for complications of the problem. And this could also be a motivation for the patient to quit kapag nakita nilang meron ng ill effects yung smoking na ongoing sa kanila. No? The next step is finding out the readiness of the patient to quit. No? So the physician will assess, is the patient ready to quit? Because the strategy is tailored fit towards how ready or not the patient is. No? Ang question na tinatanong dito sa patient is, are you planning to quit or are you willing to quit in the next 30 days? So kapag ang sagot niya ay yes, it's an indication na mukhang ready to, and we should exert all efforts na siya, tulungan na. Pero kung ang quit, we call that the quit date. No? Pag ang quit date niya ay matagal pa, baka hindi pa siya ready to quit. And we tailor fit again our management. Mostly, kung hindi pa ready mag-quit yung patient, more of patient education yung focus nung encounters or management of the patient rather than implementing intensive smoking cessation measures kasi hindi siya effective kapag it has been found out that even medications no hindi magwo-work kapag hindi pa ready yung patient So very important to tailor fit the management. So walang one size fits all na management for the patient as with any disease naman no. So customize ang management natin dito. Now if the patient is ready to quit, then we exert all efforts no to assist the patient in the quit attempt no. Now in terms of yung actual na pwedeng gawin no, actually ang initial step is what is called quit cold turkey no. So without any medication or psychotherapy or other behavioral treatment, itatry muna ng pasyente na on his own titigil siya on the quit date no. And the usual advice, syempre before nung quit date, merong preparation. And this includes explaining and educating the patient. Mostly yung mga pinag-usapan natin kanina, no? The concept of addiction, withdrawal, ano ba yung nangyari sa kanya, no? Para ma-understand niya what he will go through. And we are particularly worried of withdrawal. Kasi yun yung madalas na reason why quit attempts fail, no? Kapag hindi educated yung patient on the concept of withdrawal, matatakot sila actually, no? Na bakit kung kailan ako tumigil, parang dun pa sumama yung pakiramdam ko.
Yes, that happens.
No? So they have to be oriented and they have to expect that will happen. They need to be thought on how to manage yung withdrawal. At meron namang mga specific management recommendations yun, no? Na paano sila mag-relax. Yes.
And can I okay, just recap what you said really quick so that I know that please correct me and tell me, educate me if I'm not understanding this. Smoking is already considered a disease that you could treat or that you should treat. Like let's say high blood pressure, alcoholism, you know. So basically, some people will say, I don't want it treated. But if you want it treated, you're there. There's a way to treat them. And there's already I guess a plan, a clinical way of doing it. And the way you assess it is by interviewing, by talking to patients. So they're already at that point, there's no judgment. So people don't get scared, oh my God, I have to get a blood test, and all of these things or whatever it is. It's simply talking to someone, to a professional like yourself or another trained professional, the interview. And then talking about the quit date, you will know when if the patient is really ready, you go, if they say within 30 days, I'm ready to quit, you act aggressively. You by educating them and helping them and preparing them. If they say the quit date is maybe a year from now, you still help them out. No. But you still help them out with education. And I guess I'm in a way convincing, encouraging, so that more people will be inclined to go to you for help, no? If they really want to, because otherwise it just feels like something they have to do on their own. No, it's always the feeling they have to do it on their own. And then when we talk about actually quitting and how long it takes and why it's so hard, okay, so cold turkey, we've all heard about that. Like you just stop, period, and you don't do anything. But the difficulty, of course, one is, because addiction and it's withdrawal, and you're talking about that now. Am I understanding that correctly?
Yes.
Okay, so withdrawal, let's talk more about it. You were saying, bakit kung kailan pa ako nag-quit? Yeah, a lot of people feel that. When they quit, they feel worse. Can you tell us about the withdrawal symptoms or how it is to withdraw from smoking, whether it's cigarettes or whatever, cigars, all of these things. Okay.
So this is basically your brain forcing your body to give it a dose of nicotine. No? So parang ganun yung parang illustration ng nangyayari sa withdrawal. No? Now, we need to make the patient understand that number one, it is expected. Number two, it's temporary, no? Research showed that the withdrawal episode lasts only for a few minutes. After a few minutes, okay na sila, no? So parang malampasan mo lang yung few minutes na pinapawisan ka na malamig, nanginginig sila, no? It will get better, no? Now, the duration of these episodes, studies show, usually on the average, mga 3 months. So yun yung worst part talaga for the cigarette smoker na kailangan nilang ma-endure. After 3 months, gradually, manonote nila, nagiging less frequent na yung cravings and withdrawals, no? So, kaya karamihan ng efforts, assistance na binibigay dun sa patient is during that critical period na 3 months. After ng 3 months, medyo sana smooth sailing na yung quit attempt at tuloy-tuloy na, no? What we advise, no? So number 1 is problem solving, no? So kapag meron kang gantong nararamdaman, ano yung gagawin mo? Dapat may plan. So hindi pwedeng tatalon ka lang bigla dun sa quit attempt without any plan. Pag nagka-problem, hindi mo na alam gagawin. Ang quick solution, magsigarilyo na lang ulit kasi masosolve ka agad yung problem na yun, di ba? So for example, kung anxiety yung problem, no, baka kailangan meron silang meditation techniques na matutunan, merong distraction na pwedeng gawin, no? They need to do something other than to get their minds off cigarette smoking, no? They could avoid situations kung kailan sanay sila na nagsisigarilyo, no? So may mga ganyang strategy. And usually this action plan is written, no? Pinag-uusapan siya before the actual quit attempt para ready yung patient, no? Now, an important, just to illustrate kung ano yung mga options, an important option is actually exercise, no? Kasi pag nag-exercise, this address many of the complications of cigarette smoke with stopping cigarette smoking, no? So number 1, yung weight gain, kasi nagkaka-weight gain yung pasyente pag tumigil mag-smoke kasi babalik yung appetite nila. So pwedeng makontrol yung weight, no? Ang exercise ay nagre-release din ng happy hormones, di ba? Yun naman yung happy hormones. No? So pwedeng ano siya, ma-blunt yung effect ng withdrawal. And then it takes your mind off smoking nga kasi may iba kang fino-focus na bagay. Just to illustrate na. Now, this is strictly on a case-to-case basis kasi the physician or the counselor has to find out ano yung angkop for the patient, no? Ano yung motivations niya, ano yung problem-solving options niya, no? And tailor-fit yung management for the patient. Of course, may mga general advice, no? Now, I'd like to also go into the utility of medications or pharmacologic treatment kasi most of the medications are designed to address actually the withdrawal, no? Hindi medications are not magic pills, no, na pag ininom mo biglang hindi ka na magsisigarilyo, no? These are actually designed to lessen the impact of the withdrawal to help the patients quit, no? And this includes nicotine replacement therapy, and I'd like to highlight yung important difference nung nicotine replacement therapy with yung vape na pinag-usapan natin kanina kasi di ba hindi yung design niya makukuha mo yung nicotine, no? Ang design ng nicotine replacement therapy is that it helps the patient go through yung 3 months nga na meron siyang mga withdrawal symptoms pero gradually tinetaper yung dose. Hindi katulad sa vape na parang pinalitan mo lang yung source na ng nicotine. Yung nicotine replacement therapy, design siya na sooner or later, matatanggal siya.
Wait, what do you say to vapes that, you know, they have, I guess they sell cartridges or whatever, and there are some that say there's no nicotine, zero nicotine.
Ang usual question natin doon, so ano siya? Diba? So ano yung ingredients? Walang disclosure kasi of the ingredients. Remember, again, kung FDA ang nag-approve nito, nakasulat yun, ilang milligrams, ilang ano yung mga ingredients. Wala kasing ganun. So, ang hirap sagutin nung question na safe. Sabihin nilang water vapor lang yun, o di safe yun, di ba? Parang laruan lang siya. It's just a toy, no? Pero unlikely kasi na walang active ingredient. Kasi bakit bibili nung mga patients kung tubig lang pala siya, di ba? Steam lang pala. Parang ganun, no?
Okay, so
yes.
You were saying the critical period is 3 months, and what you do you tell the patient is 1, expect to have withdrawals. 2, the withdrawals, the parang, because you know we see people like when they withdraw, like it's really difficult, but it's not as difficult. When you're addicted to nicotine, it's not as difficult as withdrawing from other drugs.
Yes.
No? Often the dramatized ones that we see where they're shaking, okay. I mean, those we have sympathy for them. I'm not making fun of it. I'm just saying that the withdrawals where you really crave that cigarette, you can go for, you were saying 3 minutes, a few minutes.
Yes, and then sa next withdrawal na lang ulit. Parang ganun.
Ulit. Yeah, it occurs maybe a few times a day. And then you also said that you what's this? There is a plan put in place for someone who wants to quit smoking by professionals like yourself. So, and then you train them, you tell them what to do. And so you're talking about, and now you're talking about nicotine replacement therapy as opposed to vape. Because some people say, well, I smoke less. I actually know someone who stopped smoking but vapes. So, you know, I don't know. Whatever it is. I mean, I don't wanna, baka manood yun, ayoko na magsalita. Pero, I mean, whatever it is, it seems to have, baka the person's better kasi it doesn't, and it doesn't also like affect everyone else or whatever it is. Pero, nicotine replacement therapy is different from vape because you were saying
it has undergone rigorous what we call randomized clinical trials, no? So ano siya, clinical trials have been done, proven ang safety, proven ang efficacy or effectiveness, no? So it's a different matter. Now, to be clear, if and when vape undergoes the said clinical trials and has been shown to be effective, then we'll be the first to prescribe it. No? Pero until then, our advice is to not use the product because the safety and efficacy is not yet proven.
You're trying to quit and you're using the vape. You can't say scientifically that it works, but the other nicotine replacement therapies that you have, like, I don't know, you have patches, there's
there are many formulations. Yes,
there's some, and then I know someone who got injections for a while. I mean, that was parang late 90s or early 2000s, and then actually in Makati Med, she said she got injections, and then she actually tried smoking after the injections once, and she said she felt like throwing up, like it didn't, like parang she was over it, and that's how she to quit smoking. So there are also medications that you can give. Do they help the withdrawals? I mean,
yes, actually, that's the main effect of the pharmacologic treatment for cigarette smoking. They lessen the severity of the withdrawal symptoms.
So may ano naman pala, like you treat it in a holistic manner. You make a plan for the person who wants to quit smoking, and you say, okay, when is your quit date? And you also ask, like, what is it? Is the problem anxiety? Is it? And then there are other ways you can address anxiety, meditation, and maybe if they consult, do you usually also work with psychiatrists or psychologists?
This is a multidisciplinary problem, and mature smoking cessation programs actually involve, as you mentioned, psychiatry, rehab medicine, internal medicine, cardiovascular medicine, and as pulmonologist. So marami siyang teams involved.
And
yes.
Or everyone to help you. And okay, you talked about nicotine replacement therapy. Is that because you really advise people to quit cold turkey? Hindi pwedeng I'll smoke. Or I mean, if they smoke a pack today, then they lessen it themselves to 10. Or is that something they can do before they're saying, I'm ready to quit?
Yeah, that's part of preparation. No? But that's not considered quitting yet.
Yes, okay.
Talagang zero cigarette dapat. So pwede yun, part siya ng preparation, cutting down. Kasama naman po yun.
Okay, that's great to hear, doctor. Kasi yung patient din ang nagsasabi, I mean, the person saying, instead of smoking 10, I'll smoke 5 na lang, I'll smoke ganyan. That's part of the preparation. They're preparing themselves.
Yes, bargaining yan bargaining.
Bargaining,
Kapag meron kang, di ba, may stages na pinagdadaan, nagbabargaining mo. Yeah. Pero it has to be clear that that is not quitting yet. No? It's part of the preparation for quitting.
Can people come and actively seek out your help in your clinic to quit smoking?
Yes, actually, that's why I emphasize na people have to be educated that cigarette smoking is a medical condition that will warrant consultation with a physician, no? As with mataas ang blood sugar, mataas ang BP, di ba? Compelled kang magpatingin kasi siya. Ito rin, ganun kabigat na problem. No?
Are you accepting patients and helping them to quit smoking?
Yes, of course, no. Yeah, ano namin, ina-advertise nga namin yung ano na yun, service na yan, no.
Can I get your number later? I'm gonna just ask you.
Sure, sure.
All right. And then, do you have any like advice or anything else you'd like to say? I'll let you have the floor to people who want to quit smoking, whatever it is. Please go ahead.
So, as this our parting message, no, the best thing that you can do for your health right now at the individual level is to stop smoking if you are smoking. And if you are not smoking, do not start to smoke, no? Nakakalimutan minsan yun kasi sa mga, lalo sa pediatric age group, no? Ina-assume natin hindi nagsisigarilyo, but we need to advise na don't smoke, no? And we are here to help, no? Ang medical community, marami kaming pwedeng ma-offer na services to help you stop smoking. And every step of the way yun, kahit ayaw nyo or gusto nyo, tutulungan pa rin namin kayo. We're here whenever you are ready to stop smoking.
We thank you so much, doctor. Is there anything else you'd like to say, or just greet anyone before we go?
Okay. The World No Tobacco Day is coming up, so hopefully you join us in celebrating yung event na yun. So this is sponsored by the World Health Organization. No? It's at the end of the month, so baka meron kayong marinig na mga bali-balita or activities nga to celebrate World No Tobacco Day.
Let's increase awareness.
Yes,
and come back on the show, doctor. Let's talk about it again. I mean,
Sure.
It's a surprise for me to hear that it's a medical condition now. So people know that you can get help. You're not going to be judged.
Yes.
It's not that campaign. Like the campaign is not against you. It's against the product.
It's for you.
Yes, it's for you. Thank you for being on the show, doctor.
Thank you. Glad to be here.
I can refer a number of patients to you, and it would do us a lot of good. Thank you so much for being on the show. Everybody, I hope you enjoyed the show as much as I did. Thank you, doctor. This was very educational for me, and I enjoyed talking to you so much. Everybody, tune into Healthline with Makati Med next Monday, 5 p.m. To 6:30 p.m. Thanks, everybody. Bye. See you next week.
Thank you. Bye-bye.
Thank you for tuning in to Healthline with expert doctors from Makati Med, giving you the chance to interact, uplifting your lifestyle. Moderated by Nicole Jacinto. Tune in again next week for your weekly dose of Healthline.